Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views and opinions from across the world.
Hello listeners, welcome to another podcast from Medikabazaar for patients, caregivers and healthcare professionals. Today, we will talk about the issues related to chronic renal disease, also popularly known as chronic renal failure, faced by Indian population with an expert clinician, Dr. Ajay Kher. He is one of India's renowned nephrologists with 20 years of experience. Currently, he is working as a clinical director, senior nephrologist and general physician at Epitome Kidney Urology Institute. His current focus is to provide high-quality, evidence-based outpatient care to patients in India. What is the function of kidney in our body?
The major role of kidney is to filter waste product and excess fluid and to get rid of that from the body. The kidney also makes hormones that help the body make blood called erythropoietin, and also helps to control and manage the strength of the bones, which includes calcium, phosphorus and hormones like vitamin D.
What are the risk factors for kidney disease?
There are two main risk factors for kidney disease, diabetes or high blood sugar or high blood pressure. In addition, there are other medical conditions which can damage the kidney, which include some autoimmune diseases, which is where your own body attacks your body. And so these diseases can be like lupus or rheumatoid arthritis or Sjogren's. And additional diseases which could be genetic, like polycystic kidney disease. These can also impact the kidney. Also, if there are other issues like kidney disease or high risk factors, then medicines like pain medicines like non-steroidals, which includes Brufen or diclofenac, they can also damage kidneys in the setting of a high-risk person.
How can I know if I have kidney disease?
Unfortunately, kidney disease can be a silent disease. People only get symptoms once the kidney function gets below 15 or 20%. So someone can go from 100% to 15, 20% and not have any symptoms. Hence, it is very important that everyone gets checked for blood pressure, kidney function with basic blood tests and urine tests to assess if they have any kidney disease, especially if you have high risk factors, which would be that if you have diabetes or you have high blood pressure, or if you have family history of kidney disease, then it is very important that you at least get a blood pressure check, urine test and kidney function test at least once a year or more frequently depending on your condition.
What are the different kinds of kidney disease?
There are two main groups of kidney diseases. One is acute kidney injury, in which previously the kidney function was normal and something new happens that causes the kidney function to deteriorate or go down. And usually if it is something that is identified and treated, the kidney function should recover and can go back to normal as well. Another group of diseases is chronic kidney disease, in which the kidney disease increases slowly over time, over months and years. And that damage can be progressive, meaning it continues to get worse and can then lead to late stages of kidney disease, in which case the only treatment options then would be dialysis or transplant.
How do I manage kidney disease?
So if you have kidney disease, it is important to follow up with a nephrologist and get evaluated for the cause of kidney disease, the current status of kidney disease, and then based on this evaluation, there are treatment strategies and medicines that are available to try and slow down the rate at which kidney disease or kidney damage is taking place. There may not be something that can cure or get the kidney function back to normal for those who have chronic kidney disease, but we can definitely slow the rate at which kidney damage is taking place and help to maintain kidney function for long number of months and years.
What are the symptoms of kidney disease?
Once chronic kidney disease happens and the kidney function is low in the 5 to 10%, then there can be symptoms like nausea or feeling like you want to vomit, vomiting itself, poor appetite, not wanting to eat, weakness, swelling in the legs or around the eyes, itching, muscle cramps, as well as anemia, which is low hemoglobin. Those can be symptoms for kidney disease. Other symptoms can be sleepiness or having a altered sleep cycle, or feeling like you can't concentrate and have loss of concentration capacity as well.
What are the keys to living with chronic kidney disease?
3 to 4 things are critical in managing chronic kidney disease. First is good nutrition, making sure that you're not malnourished and have good diet and good nutrition. Second is good exercise. This is also critical in keeping you healthy while living with chronic kidney disease. Third is good sugar and good blood pressure control. And the fourth is regular follow-up with a nephrologist to ensure that the other medical issues that happen with kidney disease with regard to bone as well as hemoglobin are managed well while you have chronic kidney disease.
If I have advanced chronic disease and have symptoms, then what are the options?
So for someone who has chronic kidney disease at an advanced stage with kidney function that is less than 5 to 10%, then there are 3 main options for treatment. The first one is transplant. Second one is dialysis, which can be peritoneal dialysis, which is water dialysis, or hemodialysis, which is blood dialysis. We'll talk a little bit about that in the next few minutes. And then the third one, especially for people who are elderly and completely do not want to be on dialysis and are not candidates for transplant, is something where we focus on comfort and we plan not to proceed for dialysis or transplant.
When to go for transplant?
Coming to transplant, for most people, this would be the best option. So, as it is going to improve the quality of life as well as improve the quantity of life for most patients with kidney disease. In addition, the costs associated with kidney disease on dialysis continue on a monthly basis for the duration of life. And in comparison to that, a kidney transplant will have a higher cost right for the transplantation, but after that, the costs are lower. So over a period of 2 years, 5 years, 10 years, the cost of transplantation is also lower compared to staying on dialysis.
What is hemodialysis?
Hemodialysis or blood dialysis is a kind of dialysis in which blood is taken out from the body, cleaned by a machine, and then the blood is returned to the patient, which is now clean blood. This usually requires some kind of access. So access means a mechanism or a way for getting the blood out and back to the patient. Usually this can be a catheter. So these catheters can be temporary catheters or something called a permacath, which is tunneled to decrease the risk for infection going to the patient. Another option is something called a fistula, which is a surgical connection between the artery and the vein, which then the vein becomes bigger and then we can put needles into the vein to get the blood to go to the machine. Because in a fistula, there is no artificial pipe or tube in the body, the risk for infection is lower and long-term complications are lower. And so outcomes of dialysis patients with a successful fistula are much, much better. Hence, if someone is going to be on hemodialysis, having a fistula is a good option.
How do you live on hemodialysis?
Nutrition. Next is good exercise. And third is good dialysis. For good dialysis, usually you need to do dialysis 3 times a week, at least 4 hours each session. And you would want the blood flow or the flow of the pump to be at least 300 ml per minute or higher, so that you get a good cleaning of the blood in the individual dialysis sessions that you are undergoing.
What is peritoneal dialysis?
Peritoneal dialysis or water dialysis is another mechanism to do dialysis. In this, there is a catheter or a pipe or a tube that goes into the abdomen, and we put water into the abdomen. The water stays there for, depending on the method that we're using, for 2 to 4 hours, and then it is drained out. The water bathes the body, and the blood is then cleaned by this clean water that is floating around. Once the water has done the exchange and all the waste products have come into the water is drained out and new, fresh, clean water is put into the abdomen. The advantage with peritoneal dialysis is that it can be done at home. The patient or patient's family member is trained on how to do this dialysis, and it predominantly involves keeping good hygiene when you do the exchange. This would require about 30 minutes for one session, and would be done 2 to 4 times a day. Another mechanism or method to do peritoneal dialysis is to have a cycler. This is a machine that will you can connect to at night, and the machine will do the fluid in and out over the 8 to 10 hours at night. And then in the morning, you can unhook yourself from the machine and your peritoneal dialysis is done for the day. The advantage with peritoneal dialysis is that it is being done every day. And so the diet restrictions and amount of fluid you can drink are lower compared to hemodialysis. Because in hemodialysis, you're only doing dialysis 3 times a week and not every day. So the diet restrictions as well as flexibility in terms of time and duration is more with peritoneal dialysis. Another key thing to remember is that either on peritoneal dialysis or on hemodialysis, you should have regular follow-up with your nephrologist to ensure that the dialysis is going well as other medical issues that need to be managed, which include your weight, swelling, edema, blood pressure, anemia, bone disease. All of those are also being managed well while your dialysis is going on.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.